Baker's cyst, symptoms, causes, and treatments plus exercises. Pain and inflammation have become a common part of our day-to-day life. But, any pain in a particular area, coupled with the sudden appearance of a lump, is sure to leave you worried. A Baker's cyst is a lump that may occur right behind your knee. While this condition is hard of much concern, its underlying cause may need to be treated immediately to avoid further complications. To know more about natural as well as medical treatments for a Baker's cyst, watch the video to the end. What is a Baker's cyst? If you have developed a lump right behind your knee, and it is filled with fluid, it could be a Baker's cyst. This fluid-filled lump could cause a feeling of tightness. Doctors also refer to it as a popliteal cyst. While this cyst can cause sharp pain in some people, it hardly shows any symptoms in others. Signs and symptoms. Swelling behind the knee. Pain or burning sensation in the knee. Stiffness. Inability to stretch the knee. These symptoms usually worsen if you have been active or standing for too long. What causes Baker's cyst? The synovial fluid enables your legs to swing smoothly without much friction in the joints. However, sometimes, your knees tend to produce too much of this fluid. This results in the buildup of synovial fluid in the back of your knee, popliteal bursa, resulting in a Baker's cyst. This synovial fluid buildup can be caused by inflammation of the knee joint, as in the case of arthritis. An injury to the knee is like a cartilage tear. Such conditions also increase an individual's risk of developing a Baker's cyst. If you doubt that the lump at the back of your knee is a popliteal cyst, you should see a doctor rule out other serious conditions. Diagnosis. A Baker's cyst can usually be diagnosed with a physical exam. However, since some of its symptoms can be quite similar to those of more serious medical conditions like a blood clot, tumor, or an aneurysm, your doctor may carry out other diagnostic tests like an ultrasound, X-ray, magnetic resonance imaging, MRI. Once a Baker's cyst is detected, your doctor may recommend any of the following treatments. Medical treatment options. The medical treatments options for getting rid of a Baker's cyst are fluid draining. Your doctor may drain the cyst using a needle. This is usually performed under ultrasound guidance and is also known as needle aspiration. Medications. Corticosteroids, such as cortisone, may be injected into your knee to reduce inflammation and pain. Acupuncture. This is especially useful if the cause of the cyst is arthritis. Surgery. If a cartilage tear is responsible for the development of the cyst, your doctor may recommend repairing or remove the affected cartilage. If you are looking for natural alternatives to treat a Baker's cyst, we have got that covered. Home remedies for Baker's cyst. 1. Ice or heat. You will need hot or cold compress. What you have to do: take a hot compress and apply it to the affected area. Place it there for 10 to 15 minutes and then take it off. You can similarly use a cold compress. How often you should do this? Do this multiple times daily. Why this works? Both hot and cold compresses can help in reducing pain and inflammation. Hence, they can relieve the symptoms of a Baker's cyst. 2. Frankincense oil. You will need 2 to 3 drops of frankincense oil and 1 to 2 teaspoons of any carrier oil. What you have to do: add 2 to 3 drops of frankincense oil to a teaspoon or 2 of any carrier oil like coconut or olive oil. Mix well and apply it to the affected area. Leave it on until it dries. You can also leave this mixture on overnight. How often you should do this? Do this 1 to 2 times daily. Why this works? Frankincense oil has anti-inflammatory properties that can help reduce the swelling and inflammation associated with a Baker's cyst. 3. Massage. Massage, especially deep tissue massage, is a great treatment for muscle rigidness and soreness that are often associated with a Baker's cyst. It can help reduce inflammation and pain. 4. Castor oil. You will need 1 to 2 teaspoons of cold-pressed castor oil, and a warm compress. What you have to do: take a teaspoon or 2 of cold-pressed castor oil and apply it to the affected area. Place a warm compress over this for 15 to 20 minutes. Remove and rinse the oil off your skin. How often you should do this? You can do this once daily. Why this works? Castor oil contains ricinoleic acid, which exhibits significant anti-inflammatory properties. These properties can help to alleviate the symptoms of a Baker's cyst. 5. Epsom salt bath? You will need 1 cup of Epsom salt and warm water. What you have to do: add a cup of Epsom salt to a tub filled with water. Once the salt dissolves completely, soak in it for around 20 minutes. How often you should do this? Do this once daily or every alternate day. Why this works? Epsom salt is commonly referred to as magnesium sulfate due to its composition. Magnesium is quite beneficial when it comes to reducing inflammation and swelling due to its anti-inflammatory activities. Best exercise for Baker's popliteal cyst. 1. Seated hamstring stretches. What you have to do: keep your knee straight and rest your heel on the floor while you are seated. Lean forward until you feel a stretch right behind your knee. How it helps? This can help in improving knee extension, especially if it is limited from the pain. Repetitions: 12 to 15, sets 3. 2. Standing calf stretch. What you have to do: stand close to a wall. Keep both your feet pointed to the wall and step forward with one foot. Keep the knee of the other leg straight. Lean forward toward the wall and support your body with your arms while allowing your front knee to bend until you feel a gentle tug at the back of the other leg. To control the stretch of the back leg, try moving closer or farther from the wall. How it helps? A Baker's cyst often leaves the back of the affected leg feeling tight. This stretch can help relieve the tension in the back leg. Repetitions: 12 to 15, sets 3. 3. Heel slide. What you have to do: lie on the floor with your knees straight on your back. Bend your knees slowly while sliding the heel of the affected knee towards your buttocks. Once you feel a slight stretch behind your knee, hold the position for a few seconds and then return to the initial position. How it helps? For those whose knee flexion is limited, this exercise can definitely help by facilitating better stretching. Repetitions: 10 to 15, sets 3. These exercises will definitely offer relief from the pain and inflammation caused by a Baker's cyst. However, it is always better to consult a doctor. When to see a doctor? If you have developed any signs or symptoms that hint at a Baker's cyst, or if you notice that your legs have turned red or swollen, waste no time in seeing a doctor. Also, even though it is unlikely, a popliteal cyst can be the result of an underlying serious medical condition. Hence, seeking medical attention can also help put all those doubts to rest. I hope you liked this video. Thanks for watching, and are there any videos, in particular, you would like to see? Please let us know by commenting below.